Hello and welcome to the Integrated Rehab and Performance Golf Podcast. My name is Dr. Nick Curtis, running the show here at the Integrated Rehab and Performance Center. So today we're going to talk about the toe touch test. It's a relatively simple test, but there's actually a lot that we can gain from doing this exam and looking at a few different pieces. TPI likes this test for golfers, and there's a few things that they like to focus on that is really important when it comes to analyzing the movement and then correlating that to golf swing characteristics and longevity on the golf course. That being said, there are other reasons why I like to use this test from a rehab perspective as well, that we look at a few different things and focus on a few other components of it as well. So there's a lot that we can do with the toe touch test between TPI and my own assessment. With the toe touch test, it is simple. We stand with our feet together and then we bend at the waist and we try to touch our toes. Now with TPI, they will say so long as your knees don't bend and you get to the toes, then it's a pass and let's move on, which is a pretty good criteria when you're testing a lot of people and maybe you don't have a background in rehab and sports medicine. But again, I do, so we take this a little bit further. There's a lot of little components that we like to look for. So if you cannot touch your toes in the normal feet together test, then TPI will have you bend one knee and put all your weight on the other long leg and then do it again. So this is testing for asymmetry. Here we get to see if the reason you could not perform or pass that toe touch test is because one side is giving you those limitations as opposed to both sides, right? And so here we might be able to see that you can actually touch your toes when you bend one knee and put all your weight onto the straight leg and say it's the left leg, you can touch your toes now. And then we switch back to the right leg and we bend your left knee and we go and touch your toes and you still can't do it like you couldn't before. That indicates, well, there's an asymmetry here. It's more of a right hip, maybe right posterior chain issue. And it also kind of rules out the spine as an issue as well. So with that, we know a little bit more about how to treat. Now, the significance here for the golf swing is we need to know how well you hinge, right? So the hinge and backward weight shift is actually a very important component of a toe touch. If you see no posterior translation or no shifting backwards of the hips during the toe touch test, that is a motor control issue in which we do not understand how to hinge appropriately, right? And we are probably either utilizing very, very flexible, probably hyper flexible hamstrings to get to the ground, or we are doing all our work from our spine and our back, and we are rounding and hinging at different points in our back to get that distance if we are even touching the ground, right? And if not, then we're probably not touching the ground and we can't hinge and we don't have a lot of flexibility in these parts, and that'll show in the toe touch test. All right, so now there are plenty of other things we like to look for. So besides not being able to touch your toes or not hinging appropriately, I also like to see where the back, right, the spine is hinging from, right? Is there one spot in that back where we are getting an acute angle, right? So that there's just way more flexion coming from one little part of the spine than the rest, where the rest might be either flat or, in a good sense, it has a nice, well-rounded kind of curvature to it. And then all of a sudden you get to a point where it bends and it crunches down acutely, right? We want to know where the flat parts are and where those super acute angles are, because we want to work on those. That's where we take things a little bit further. And there's plenty of stuff we can do with the rib cage and the spine, especially as a chiropractor, of using that adjustment as a tool to get things moving and working on some mobility through that spine, and then working our way into some exercises and especially some breathing drills to get that spine to open up, get that rib cage moving again in the correct way, to make sure that we are getting a little bit of motion back through those flat parts, and then shoring up those acute angles where we are going to relearn how to get a global flexion through the spine as opposed to those very sharp angles, right? Very important that we work on these things. Now back to TPI, they have a lot of different ways that this correlates to the golf swing. And again, if you're not hinging, you don't have a posterior weight shift, and you can't do that very well, now we can't do that in the golf swing either. It's very important to be able to shift that weight, especially a little bit backwards, to be able to get into that backswing without compensating. So compensations can include kind of this excessive knee bend, or we are kind of coming out of our posture, right? So loss of posture, flat shoulder plane, things like that, where now we're supposed to be very precise with which movements are coming from where. When we go to address the ball, we come back into our backswing, and our angles are completely different than they were at address. And now we have to try to refine those angles or compensate in a different way as we go back down to ball strike. And that leads to all sorts of our problems that many of us are pretty familiar with, right? Whatever it might be. So again, things that we can work on and things that we're looking for is there some tightness in that posterior chain, right? The back of the legs, the hips, and the upper back. Things that we can do here is, well, we can work on the hamstrings, right? So sometimes it is the hamstrings that are a little bit tight, but probably less often than you think. And if they are tight, oftentimes it's because of other reasons, right? And this is what a very detailed and thorough further assessments help us find out. So things like the FMS toe touch progression, you can find that on my YouTube channel. I have a video where we go through that, so check that out. That kind of helps open up that posterior chain, and we even get a little bit of work on the motor control where we're learning some of those hinge mechanics. Now, to work even more so on the hinge mechanics and opening up some stuff in the posterior chain, especially the glutes and the hip capsule, really important we work on this. Things like the kickstand hinge are a great exercise here where we learn how to hinge, we get eccentric or lengthening of the glutes and the posterior glute muscles there, and other fibers and fascia, where we get to open those up, right? And all of a sudden, we have access to that hip capsule again, where we are hinging backwards. It's a great exercise, not only for actually building some hypertrophy in the glutes. It's a very simple exercise. We don't load it very heavy at all, but it's a completely different stimulus in the posterior glute muscles and capsule, where we're actually finally lengthening that glute through its full range of motion. And we're doing that with a ton of load into it, even without having to use too much weight or even any at all. So a completely different exercise, but it's fantastic for learning what it feels like to actually hinge. Really important. It's lights out for golfers. So look that up on the YouTube channel as well, or the Instagram, where I've done a lot of stuff, especially in the hinge week, where I went over unlocking the secrets of the hip hinge. You can look that up. It's one of the earlier posts. And we'll find some progressions to do from there. Another example is a seated hinge, where we're really just focusing on what it feels like to actually hinge, where we focus on feeling the sits bones, those bones in the bottom of the butt that will contact the chair when we're seated. And what we do from there is we hinge forward and we feel ourselves rocking over those bony parts. And that's what it feels like to actually hinge, right? And then we take that to a kneeling position as a progression, and we start to do that. And now we have a little bit more load. Now that we're on our knees and we're hinging from that position, and again, just working on feeling what it looks like to actually hinge and not arch at the back or anything like that, and get all that motion just from the hips. Excellent progressions, and then up there to the kickstand hinge. Now, otherwise, we want to look at the back and the spine, right? So if someone touches their toes without bending their knees, I'm not so quick to progress to the next thing like TPI might be, because we could just be getting all that motion from an acute, aggressive flexion in the back, whether that be the lower back or, especially more often, that upper back. And I'm guilty of this a little bit myself. So some exercises we like to do here is, first of all, doing some adjusting and getting some parts of that spine that aren't moving so well, moving again, so that we can get that relative motion from vertebrae to vertebrae to vertebrae, as opposed to just that one spot where we've learned to hinge from and flex from, right? Then from there, we want to work on the rib cage, right? So we're going to do some breathing exercises to make sure that the rib cage is stacked, staying over the pelvis as it should, but actually getting motion through each rib as we breathe in and breathe out, and then put ourselves in different positions to stress different parts of the rib cage and the spine and all the muscles that are restricting that motion in a very strategic way based on further examination, right, to get those things moving again. Okay, pretty soon here I'll have some examples of some breathing drills and exercises that will start opening up certain muscles in the back, the upper back, mid back, and lower back, and getting, and the front as well as the chest and sternum, and starting to get that motion back into that rib cage. Again, lights out for golfers to get those things moving again, and then working on mastering our hinge, right, and our upper back and mid back mechanics there. So really great stuff. Okay, and so to recap, the toe touch test, it's a simple test, really important. It's got a lot of correlations to the golf swing, things like loss of posture, flat shoulder plane, and early and excessive knee bend. right? Pretty much what happens here is if we don't have the mobility in our posterior chain, or we don't have the biomechanics or the mechanics to hinge properly, then when we go from address to our backswing, so many things start to change. There's so many things that are moving that shouldn't be as compensation. And again, it has a lot to do with those issues that you are struggling to shake in your golf swing, right? And so we have a lot of things that we can work on. We work on posterior chain tightness. We work on hip capsule tightness. We work on mechanics of the hinge. So we learn how to actually hinge and build strength in the hinge. And then we work on that spine and making sure that we are getting uniform flexion throughout the spine as opposed to only a few certain points. And we work on spine and rib cage tightness and upper back, mid back, low back, and chest tight musculature to open things up and get you moving freely again so that you don't have to compensate. And when you do some golf drills, whether it be from YouTube, whether it be some drills that I've given you, or it's from the golf pros, that you can actually achieve the positions that they're asking you to achieve, and you're not having to force yourself in these positions, which will never, ever correlate to consistent golf play. So thanks for tuning into the podcast this week. Again, check out the YouTube channel for some of these drills and exercises and some others that I have mentioned, and check out the Instagram to see some progressions in the hinge, the squat, and some other concepts that I talk about like internal, external rotation, as well as more to come. So thanks for tuning in. We'll see you next week.